my friends. Tonight I'm speaking to you about a matter of the greatest possible importance. On March 24th, 2019, I first spoke to you in a video address to the city about the COVID-19 emergency. On that date, Lawrence County had no reported infections. No lives had yet been taken locally, and just 5 deaths from COVID had occurred statewide. Today, that number is 5,139. What I asked of you then is that we all do whatever we could to flatten the curve so that we don't needlessly spread infection. And in large part, for a time, we did what we needed to do to keep that from happening. What we feared would happen is that we would overwhelm the resources of our healthcare system. When I spoke to you in March, I said, the steeper the curve of infection, the harder it will be for our healthcare system to treat all the patients who need treatment. So we worked to make sure that we didn't run out of beds or ventilators or cause infection to nurses or doctors or first responders, or worse, force physicians to make decisions about who would receive care and who would not. The grave news I must share with you today is that what we feared has now happened. Right now, all Prisma Health hospitals in the upstate are at capacity, including Lawrence Hospital. Let me repeat that. Lawrence Hospital is at capacity. The 3rd floor of our hospital has been converted to a surge area for COVID patients from our area and from other Prisma facilities across the upstate. This will provide approximately 29 additional beds, but unfortunately, this is not enough beds to meet our needs. Extra stretchers have been ordered, and hospital officials are exploring other facilities which might be used to house patients. Our critical care unit is full and overflowing, and critical care patients are having to be placed in alternate sites as they become available. As a result, the National Guard has been brought in to provide medics who are able to help support what is becoming a field medicine scenario. In addition, community family medicine doctors and nurses are being called up to help treat the sick. We are now, or will very soon be, at the point where hospital physicians will have to prioritize patients and determine who receives treatment and who does not. I will pass along to you the urgency of this situation exactly as it was communicated to me. People will have delayed care because of the overwhelming situation, which could have devastating consequences to your neighbors and to you. Now it is time to break the glass. I am sounding the alarm. This is not a drill. We must all take immediate, aggressive action to stop the spread of infection and allow our healthcare facilities to catch up. In a time of war, there are battles and skirmishes where the forces of warring nations inflict injury and death. And in a time of war, wounded soldiers are treated by battlefield medics who do their best to look after them and nurse them back to health. And then the battle ends, and there's a time for rest and recovery, both for the soldiers on the front line and the medics who treat them. We too are at war. We are fighting a virus. And since February 2019, our doctors and nurses have been working nonstop, without rest, day and night to fight this virus, and they are exhausted. While we must have beds and hospital space and ventilators and PPE and drugs to treat those suffering from this virus, and all the other injuries and illnesses and births and treatments that send people to the hospital, the biggest, best equipped hospital will not do us any good at all if we don't have the healthcare workers to treat patients. We've taken their work for granted. We've taken the guarantee that there will be a hospital with a bed waiting for us if we need it for granted. Now, we must accept the sobering reality that those guarantees are not absolute. We are maxed out, and our frontline healthcare workers need our help. What are they asking of us? The same thing they asked of us in March. Wear a mask, wash your hands, distance yourself from others, avoid group gatherings. It's hard to tell you about the urgent, dire nature of our challenges without revealing the heartache I have felt and that I have seen in others. Just today, I received a call from a mother who was suffering and crying because she couldn't be present to comfort her adult son, who is now struggling to live and breathe. Members of my own church congregation have died. Others are sick. And I know all of us are tired. We are exhausted of hearing about this virus, and it just seems to go on and on and on. Whereas many of us felt a healthy fear when the first case of infection was announced in this county, now we regularly see 30, 40, 50 or more infections every day. And many have chosen to go about their lives as if there were no danger to any of us. And just as we saw the virus wreak havoc in other communities and cities across the nation, we now see the human cost of this pandemic in our own town. Today, 2 additional deaths were reported in Lawrence County, one of whom was a middle-aged individual. We must not grow calloused to the death, suffering, and sacrifice of others. It is time for us to respect that loss of life, suffering, and sacrifice by doing the very basic things which each of us has been asked to do to fight this virus. The end of this war is in sight. There is a vaccine being administered right now to members of our community, our healthcare workers, and our first responders. But with victory in sight, we must not lose our resolve. We can't give in to the temptation to accept defeat or deny the danger of the enemy, especially considering the lives that would be lost if we do. Instead, we must be strong and courageous and do all that we can to give our frontline healthcare workers a fighting chance to save our friends and family members who need them most. We can no longer pretend that the consequences of our actions do not matter. We must all do our part. And my friends, I have hope that we will rise to this challenge. And soon, victory will be ours. I'll end tonight with what I told you back in March. I said, that's all for now. Until you hear from me again, stay safe, practice good hygiene and social distancing, support local businesses, and most importantly, love your neighbor. Let's look out for one another. Thank you.